Hello and welcome. Today we're diving deep into a condition that affects the kidneys, the vital organs responsible for filtering our blood and maintaining fluid balance. Glomerulonephritis. Glomerulonephritis, often called GN, isn't a single disease, but rather a term encompassing several conditions that cause inflammation and damage to the glomeruli. These glomeruli are tiny filtering units within the kidneys, essential for removing waste and excess fluids from the bloodstream. The causes of glomerulonephritis are diverse. Some cases are triggered by infections, such as strep throat, leading to what's known as post-streptococcal glomerulonephritis. Others are caused by autoimmune diseases like lupus or vasculitis, where the body's immune system mistakenly attacks its own tissues, including the glomeruli. Genetic factors can also play a role in some forms of glomerulonephritis. In certain cases, the exact cause remains unknown, referred to as idiopathic glomerulonephritis. Now, let's understand how glomerulonephritis affects the kidneys. Imagine the glomeruli as intricate filters. When they become inflamed and damaged, their ability to filter blood properly is compromised. This leads to several consequences. Firstly, protein, which normally stays in the blood, can leak into the urine, a condition called proteinuria. Secondly, red blood cells may also leak into the urine, known as hematuria. These leaks signal a problem with the integrity of the glomerular filter. As the kidneys struggle to filter waste, substances like creatinine and urea accumulate in the blood. This buildup can lead to further complications and can eventually cause kidney failure. Fluid retention is another consequence, resulting in swelling, particularly in the legs, ankles, and around the eyes. Determining the precise epidemiology of glomerulonephritis is challenging due to its diverse causes and presentation. However, it is known to affect people of all ages, genders, and ethnicities. Some forms of glomerulonephritis, like post-streptococcal GN, are more common in children, especially after a streptococcal infection. Other forms, linked to autoimmune diseases, may be more prevalent in certain populations or age groups. Glomerulonephritis is considered a relatively uncommon condition, but it can be a significant cause of chronic kidney disease and kidney failure globally. The incidence varies depending on geographical location and the prevalence of underlying risk factors. The signs and symptoms of glomerulonephritis can vary depending on the severity and type of the condition. Some people may experience very mild symptoms, while others may have more pronounced symptoms. Common signs include hematuria, or blood in the urine, which may cause the urine to appear pink, red, or cola-colored. Proteinuria, the presence of protein in the urine, may not be visible but can be detected in a urine test. Edema, or swelling, is another frequent symptom, particularly in the legs, ankles, feet, and around the eyes. High blood pressure is also common due to the kidneys' impaired ability to regulate fluid and electrolytes. Fatigue and weakness can occur as a result of the buildup of waste products in the blood. In severe cases, glomerulonephritis can lead to decreased urine output and even kidney failure, causing nausea, vomiting, loss of appetite, and shortness of breath. Diagnosing glomerulonephritis typically involves a combination of medical history, physical examination, and laboratory tests. A urine test is crucial to detect the presence of protein and red blood cells in the urine. Blood tests are performed to assess kidney function, measure levels of creatinine, urea, and electrolytes, and detect any signs of inflammation or infection. An important diagnostic tool is a kidney biopsy, where a small sample of kidney tissue is examined under a microscope. This helps determine the specific type and severity of glomerulonephritis and guides treatment decisions. In some cases, imaging tests such as ultrasound or CT scans may be used to evaluate the size and structure of the kidneys. Glomerulonephritis is broadly classified based on its cause, pattern of glomerular damage, and clinical presentation. Some common classifications include acute glomerulonephritis, which develops suddenly, often after an infection; chronic glomerulonephritis, which progresses slowly over time and can lead to kidney failure; primary glomerulonephritis, which occurs when the kidney is the primary site of the disease; secondary glomerulonephritis, which results from another underlying condition, such as lupus or diabetes. Specific types of glomerulonephritis include IgA nephropathy, membranous nephropathy, focal segmental glomerulosclerosis, FSGS, and membranoproliferative glomerulonephritis, MPGN. Each type has its own distinct characteristics and treatment approaches. The treatment and management of glomerulonephritis aim to control inflammation, preserve kidney function, and manage symptoms. Treatment strategies vary depending on the type and severity of the condition. Medications are commonly used to reduce inflammation, such as corticosteroids or immunosuppressants. Blood pressure control is crucial, and medications like ACE inhibitors or ARBs are often prescribed. Diuretics may be used to reduce fluid retention and swelling. Dietary modifications, such as limiting sodium and protein intake, can help ease the burden on the kidneys. In severe cases, dialysis or kidney transplantation may be necessary to replace kidney function. Managing underlying conditions like infections or autoimmune diseases is also important for treating secondary glomerulonephritis. While it may not always be possible to completely prevent glomerulonephritis, certain measures can help reduce the risk. Prompt treatment of infections, such as strep throat, can prevent post-streptococcal glomerulonephritis. Managing underlying conditions, like diabetes and high blood pressure, can also help protect the kidneys. Avoiding certain medications and toxins that can damage the kidneys is also important. Regular checkups with a healthcare provider can help detect early signs of kidney problems. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can also support kidney health. The prognosis of glomerulonephritis varies greatly depending on the type, severity, and response to treatment. Some forms of glomerulonephritis may resolve completely with treatment, while others may lead to chronic kidney disease and eventually kidney failure. Early diagnosis and treatment are crucial to improving outcomes. Recent research has focused on developing more targeted therapies for glomerulonephritis, including new immunosuppressants and anti-inflammatory agents. Researchers are also exploring the role of genetics and biomarkers in predicting disease progression and response to treatment. Advances in dialysis and kidney transplantation have significantly improved the survival and quality of life for people with end-stage kidney disease.